Hi, my name is Tara. I'm a first-year medical student at the University of Toronto.
My name is Patricia, and I'm a first-year medical student at the University of Toronto.
Hi, my name is Brian Kim, and I'm a second-year medical student at U of T.
Hi, my name is Lena. I'm a second-year medical student at U of T.
Hi, my name is Annie Wang. I'm a second-year medical student at the University of Toronto.
So earlier in this year, the series hosted 2 speakers at our school, and we really had the incredible opportunity to hear their stories and understand more about their experiences and what they look for in their physician and the kind of care that they would like to receive. And I think for me, that really helped tie together the medical aspect as well as how do you keep patients at the center and how do you make sure that all of their human and holistic needs are being met. And so it was incredible to meet them and be able to talk to them and hear more about their story.
One particular event that stood out for me was an interview with a lawyer who came in to speak about HIV in the law. And I learned a lot about the implications of having an AIDS diagnosis or an HIV positive diagnosis that pertains to the legal system. And so it teaches me going forward that there are things we need to be cognizant of as doctors, not only in the medical issues, but also in the legal issues.
And so through this elective, I was able to challenge my own ideas and assumptions and some of the societal stigma that exists on HIV. And I think moving forward in my medical career, that will help me to provide a non-judgmental care to my patients.
I think the experience that has impacted my plans as a future physician the most was the HIV Buddy Night, where we got to speak to patients who are living with HIV or AIDS currently. We got to hear about their experience getting diagnosed and also, perhaps most importantly, their interactions with the healthcare system and getting to ask them the things that they liked about their interaction with the healthcare system, but also the things that they didn't like so we don't make the same mistakes that our predecessors may have made moving forward, and also understanding the barriers that these patients faced when trying to access care and how we could be advocates in the future to try to minimize those barriers.
I had the privilege of shadowing an infectious disease physician as well as a family physician who take care of patients living with HIV. And I was able to shadow them longitudinally. And it really showed to me that to be a good physician, you should look beyond the illness and treat them holistically as a person. And I think this is something that applies no matter what discipline we choose to go into.